Hi, this is Rachel, an obstetric nurse, and I'm here to talk to the newer nurse about how to organize and how to write out their cheat sheets or brain sheets, just to stay organized, specifically speaking for the labor and delivery patient. So you will want to start off your shift writing down all of the information, like I said in my previous video, in a separate color pen. And like I said, to be more organized, it's best to write down what somebody had told you that they did on their shift in a different color than the actual actions that you do on your shift. So then you would write what you do on your shift in the darker color, like black, whatever you use through your shift. So I'm going to go ahead and show you this piece of paper. What I usually do when I start my shift out, specifically with the labor and delivery patient, is I get a brand new white, clean, crisp piece of paper from the copier. And then I just fold it in half. Then what I do is I start with the fold on your right, my right, and I start with all my information on one side that I've been told in report, and then I have it available to open up and write more stuff on the other side of the paper in case either the report takes a while or is long-winded, or there's just an extensive background that it needs to be in order. But basically it's just a half sheet. And that's pretty much what I use when I'm going back and forth to the room. If I'm starting something new, a new medicine, the start time of an IV, whatever have you, I have this half sheet of paper that's small enough to go into my pocket of my uniform, but also large enough to unfold and put more information on. So we'll go ahead and I'll give you an example of how it's written. So this is an example of one of the cheat sheets or brain sheets, and excuse my handwriting, I am not the best handwriter, but this is how I keep track. This is extremely detailed for me and completely relevant in what I do each day. So if you start from the top, I always start with the patient's room number, the patient's name, their gravidarum status, their blood type, GBS status, what time they were ruptured, their due date, their allergies, if any, for medications or other items, the doctor that they see, their OB doc, and then as I go through it, the items on the left-hand side are going to be what is personal to them, their personalized information. So husband or significant other, following up with which doctor for their baby that the baby will see, like pediatrician or a family practice type of doctor, whether or not they're planning on boy or girl, or if they don't know, if they're going to be breastfeeding, bottle feeding, or both. This is some past medical history, so just anything in their past, like surgeries or complications they may be having. Prenatal meds, what were they taking during their pregnancy before labor? And then also vaccinations. So the top three that are pretty important for our department is their Tdap status, flu, and pneumonia. And then those are ever changing. And then also we like to look at their record to find out if they're rubella immune or non-immune, if they're Hep B positive or negative, and then also HIV positive or negative. Normally I won't put all of the rubella, Hep B, or HIV statuses as long as they are negative or not an issue during my shift. Then moving on to this column, I have the IV. So basically stating which location is the IV in, what size needle, and what fluid is running. Their pain goal. Sometimes this is more relevant for postpartum patients, but also for us, like different interventions that they like to do. Do they like the light stim? Do they like to get up and walk? Do they like warm blankets? That type of thing. And then also any pain medication that we give them. And then also if they're going to be getting an epidural, what time was that administered, or what time it's running at, how much it's running at. So in the middle is where I put information regarding the reason why they're here. Why is this patient here? To write the admit time and date. Type of things, signs or symptoms, is the patient bringing or presenting leading up to why they're here. And then I always like to keep track of the last time the patient was checked and how their progress is coming. So now I will give you an example of all of this filled in. Right. Here is an example of a brain sheet that I filled in with a made-up person. So the example would be that in room 1, we have Jane Doe. She is a Gravida 3, Para 2 patient that sees Dr. McSteamy. She is A positive blood type, GBS negative, which GBS again stands for group beta strep. That's a pretty important test that we run right before vaginal deliveries. Well, we want to know the status of the patient before they deliver. And then if they have ruptured, what time was it at? And was it spontaneous rupture of membranes? Was it artificial rupture of membranes? And then the time. This says no known drug allergies, so she doesn't have any allergies to drugs or any other allergies that needed to be made note of. And then this is her due date, 5/1/15. So Jane is here for induction because she is post-dates. She came to us on 5/7 at 0700. She is not contracting, she's not bleeding, and she has no loss of fluid, so no membranes have been ruptured. She wants IV pain meds and also an epidural. She was last checked, she was last checked, sterile vag exam was done at 10:15, and she was 4, 80, and -2. She can have clear liquids, and baby is tracing better on the left side. Baby's heart rate's in 135s, and baby's reactive. So here is some information about her history. Bob is the name of her husband. She's following up with Dr. Fancy. Baby will be seeing Dr. Fancy. They're expecting a baby boy. She wants to breastfeed. History on mom is that she had knee surgery in 2000, and she also has asthma. So the meds that she took prenatally are prenatal vitamin, iron, and albuterol inhaler, PRN. Her Tdap status means that she is not a candidate to receive that at this time. Flu, she does want the flu shot. And pneumonia, she is a candidate to receive that, and she does want that. Currently, she has an IV in her right hand. It is an 18 gauge, and it's D5LR for the maintenance fluid, and it's running at 125. So these are the shorthands, nitty-gritty of all the information I need at the start of my shift. Now I'm going to show you what it looks like in black ink when I start filling in some of the things that I've been doing on my shift. Okay, so here's an example where I used my black ink, and now I'm writing in on that same piece of paper that the patient received IV pain medicine of fentanyl, and it was 100 micrograms that she was given at 1300. She also received warm blankets to her lower back. And then finally epidural was placed at 1400 and is running at 10. She had a sterile vag exam, and that was at 1430. And she was 7, 100, and 0. So 7 centimeters dilated, 100% effaced, and 0 station. So basically, if for any reason I had to change my patient, or if my shift was a short shift, I have all the information that I've given to this patient or the things that I've done with the patient that I've put in black. So then if I have to give a report quickly to another nurse, I can give that information of all of the background information I got from the previous nurse, all of my new information in my black ink, and then I can paint the best picture to give report to the next nurse. Now, there are some things that I would give report on. So that is my basic interpretation of what I like to do when I'm working labor and delivery. Not everybody is going to want to do it the same, nor should they. But this is just an example of what works for me. And what I like about it is the fact that this piece of paper that explains all that information is easily folded. I can put it in my pocket, And then at any point during my shift, if the doctor or anesthesiologist or another nurse has a question about my patient that I don't know off the top of my head, then I can whip out my paper, look at my information, and answer their question. So that is some things that I do that works for me. I know other people on our unit, like when it's a newer nurse that's starting, they will use a clipboard. And even some of our experienced nurses use these clipboards. So this is an example of one of the clipboards. And I received one and I used it quite a bit of time. You can put a lot of information on the inside there. A lot of papers of important things that work for you. I hope this information helps you. I hope that you can manage your time efficiently by writing down and being organized. And I hope that you are doing well on your units. So take care and stay tuned for the next video.